Welcome to Delta Dental of Arkansas. We are proud to serve your child. Our goal is to give your child access to quality dental care. Delta Dental Smiles for Kids benefits will help you keep your child's teeth healthy. Delta Dental of Arkansas's role is to provide access to care through a primary care dentist, help you understand your child's benefits. We are here to help if you need us. Our toll-free number is 1-866-864-2499. For Relay Arkansas, dial 711. For hearing-impaired services, please use the Relay Arkansas number. You will need to tell them our toll-free number. Days and hours excluding holidays are Monday to Friday, 7 a.m. to 7 p.m. Our website is deltadentalsmilesforkids.com. To reach us by mail, our mailing address is Delta Dental of Arkansas, P.O. Box 6427, Sherwood, Arkansas 721724. Eligibility. Eligibility is determined by the Arkansas Department of Human Services, DHS. For more information, see the DHS Medicaid Handbook. If you need us, please contact us if you have any questions about Delta Dental Smiles for Kids, such as finding a dentist, or help making a dentist appointment. Our toll-free number is 1-866-864-2499. Using this handbook. This handbook explains the following: Delta Dental Smiles for Kids benefits, how to use benefits, rights and responsibilities. This handbook also helps to answer some questions people often ask. This handbook cannot tell you everything. Laws and rules change, so some things might have changed since this book was printed. This handbook is not a legal document. It is just a guide, not a contract. Call us at 866-864-2499 if you have questions. There are some terms used in this handbook you should understand. Your child or beneficiary is a person enrolled in Delta Dental Smiles for Kids. We, us, our is Delta Dental of Arkansas. Primary care dentist is the dentist you pick to provide services to your child. See page 8 for more information. Delta Dental Smiles for Kids Network Dentist. This is a dentist who has signed an agreement with us to provide services. Medically necessary. This is a product or service that is medically necessary if a sensible dentist would provide the service to prevent, diagnose, or treat your illness, injury, or condition. The service must be provided by generally accepted standards of dental practice. When there are changes. Sometimes we need to make changes to this handbook. If so, we will let you know in writing 30 days before the changes happen. Dental care. When should your child see a dentist? Babies should see a dentist at 12 months old. If your child does not have teeth at 12 months, schedule your child's first dentist appointment as soon as their teeth break through. Children should see a dentist within 90 days of enrollment in Delta Dental Smiles for Kids. After the first appointment, your child should see the dentist every 6 months, twice a year. Regular dental visits can prevent major problems that cause children to miss school and parents to miss work. Be sure to schedule the next dental visit before leaving the dentist's office. What to expect at the dentist for children. Recommended by the American Association of Pediatric Dentists. When you take your child to the dentist, here is what you can expect to happen. 6 to 12 months. At your baby's first dentist visit, your baby will sit in your lap and the dentist will look in your baby's mouth. The dentist is checking to make sure teeth are healthy and talking to you about how likely it is that your baby will get cavities based on what they eat, bottle or sippy cup use, and family history. The dentist will show you how to take care of your baby's teeth. The dentist may clean your baby's teeth and apply fluoride. The dentist may take x-rays of your baby's teeth. 12 to 24 months. The dentist will examine your child's mouth and teeth, clean teeth, and apply fluoride. The dentist will ask questions to see how likely it is your child will develop cavities and may take x-rays. 2 to 12 years. The dentist will examine your child's mouth and teeth, clean teeth, and apply fluoride. The dentist will ask questions to see how likely it is that your child will develop cavities and may take x-rays. The dentist will check to see if permanent teeth are coming in crooked and will talk to you about sealants, a clear plastic coating painted on back teeth to prevent cavities. 12 plus years. The dentist will examine your child's mouth and teeth, clean teeth, and apply fluoride. The dentist will ask questions to see how likely it is your child will develop cavities and may take x-rays. The dentist will check to see if permanent teeth are coming in crooked and will talk to you about sealants, a clear plastic coating painted on back teeth to prevent cavities. Taking care of teeth at home. It's very important to see the dentist, but taking care of teeth at home by brushing and flossing is key to keeping teeth healthy. Toothbrushing and flossing. It is important to brush teeth twice a day, after breakfast and before bed. Use a soft, bristled toothbrush and toothpaste that has fluoride. Your child doesn't need to rinse after brushing. The toothpaste left in their mouth helps protect teeth against cavities. Floss teeth once a day. The best time for flossing is at the bedtime brushing. This will get food out from between teeth so it doesn't stay there all night. Replace toothbrushes every 4 months. If your child has been sick, replace their toothbrush so it isn't passing germs. Sharing toothbrushes means sharing germs. You can label toothbrushes with a permanent marker to prevent using the wrong one. Toothbrushes should be kept upright with the bristles on top. Don't cover toothbrushes. They need to dry out. Babies and toddlers. Taking care of your baby's mouth. Helping your baby have healthy teeth starts at birth. Baby's gums should be wiped twice a day, using a wet gauze pad or a clean, damp cloth. Gently wipe all the surfaces of your baby's gums. When your baby has teeth, start brushing using a soft infant toothbrush and a smear of fluoride toothpaste about the size of a grain of rice. Don't worry about your baby not being able to spit out the toothpaste. The toothpaste left in your baby's mouth helps to protect teeth. Protecting teeth. Visit the dentist every 6 months, twice a year. Children should never be put to bed with juice or milk. This can cause severe tooth decay, rot the teeth. Only water should be given after brushing at bedtime. Use soap and water to clean baby bottles, sippy cups, pacifiers, and teething toys. Don't clean them by putting them in your mouth because it may pass bacteria causing tooth decay to the baby. It is natural during teething for children to suck fingers, thumbs, or pacifiers. Sucking can make the permanent teeth come in crooked, so be sure to talk to your dentist about this. Drink fluoridated water and use fluoride toothpaste. Eat a well-balanced diet and avoid sugary foods and drinks. Children age 3 and over. To keep your child's teeth healthy, brush teeth twice a day, after breakfast and before bed, with a soft, bristled toothbrush and toothpaste that has fluoride. Use an amount of toothpaste about the size of a pea. Make sure you brush all teeth on the top and the bottom and in the front and back of teeth. Floss teeth once a day. The best time is at the bedtime brushing. This will get food out from between teeth so it doesn't stay there all night. Limit snacking in sippy cups. Have regular meal times and regular snack times. All-day snacking and drinking can lead to cavities. Talk to your child's dentist about ways to protect your child's teeth, including putting fluoride on teeth. Dental sealants, a thin plastic coating painted on back teeth to prevent cavities. Tell your dentist about any habits your child may have, such as thumb sucking, that could affect their teeth. Primary care dentist, PCD. What is a primary care dentist? A primary care dentist, PCD, is a dentist who will be your child's regular dentist. It is important to have a dentist your child will regularly see. Your child's PCD will help them stay healthy and keep track of dental needs. If your child has special needs outside of regular dental care, like a mouth injury, your child's PCD can help make arrangements for care. Choosing a PCD. Once your child is signed up with Delta Dental, you have 30 days to select your child's PCD. If you do not choose one, Delta Dental will choose one for you. To find a Delta Dental Smiles for Kids dentist, visit www.deltadentalsmilesforkids.com. The search will help you find a dentist near you. It can also tell you things about each dentist, such as their office hours or languages spoken in the office. Call us for help finding a dentist or with questions, toll-free at 1-866-864-2499. Using a dentist who is not your child's PCD. We hope you will always try to use your child's PCD when getting dental treatment, but it is not required to only have dental treatment from your child's PCD. Your child can have dental treatment from any Delta Dental Smiles for Kids dentist. Changing your PCD. You can change your child's PCD at any time. Call us at 866-864-2499 to let us know you want to change your child's PCD. We can help you find a new PCD. Choosing a dentist not in the network. If you choose to see a dentist that is not part of the Delta Dental Smiles for Kids network, you may have to pay for services provided by this dentist. If you think your child may need to see a dentist that is not part of the Delta Dental Smiles for Kids network, contact us first. We may be able to help you decide if a network dentist can provide the services. What if my PCD leaves the network? If your child's PCD leaves the Delta Dental Smiles for Kids network, we will let you know. We will also send you information on how to select a new dentist. Scheduling an appointment. After you pick a PCD, call your PCD to make an appointment. Make sure the dentist is part of the network. Make sure they know you have Delta Dental Smiles for Kids. Call us for help making an appointment. Be sure to take your child's Delta Smiles for Kids ID card to the appointment. What if I need to cancel my dental visit? If you cannot keep the appointment, be sure to call the dental office to cancel the appointment. When possible, please try to cancel the appointment at least 48 hours prior to the appointment. This helps the dentist find someone else for your appointment time. Try to reschedule your visit for another day. What if I miss an appointment? A missed dental appointment presents a problem for both you and the dentist. It causes a delay in improving your child's dental health. The dentist holds appointment times just for you. Please value your dental appointments. Many offices have missed appointment policies. Ask about your PCD's policy. Your PCD may decide to not see you if you miss appointments without calling. ID cards. We mail each new beneficiary a temporary Delta Dental Smiles for Kids ID card. Once there is a primary care dentist, you will receive a new ID card. The card contains a lot of information. Information about Delta Dental Smiles for Kids, basic plan information and your ID, and some PCD information. It describes where to send claims to P.O. Box 6247, Sherwood, Arkansas 72124. The payer ID number 710561140-DDAR. Customer service 866-864-2499. And the state of Arkansas 800-482-8988. Also, our website is provided, www.deltadentalsmiles.com. Note that this card is not a guarantee of payment. The ID card is for dental services only. This card has important information about your dental benefits. Please present this card to your dentist every time you visit their office. Only your child whose name is on the ID card can use it for dental services. If someone else uses the ID card to get services, that person will have to pay for the services. Letting someone use your child's ID card is fraud and can be punishable by law. How to replace a lost ID card. If you lose the ID card and need to get a new card, you can call us toll-free at 1-866-864-2499 as soon as you know your child's card is missing. Print one on the customer toolkit at www.deltadentalsmilesforkids.com. Non-emergency transportation. Need a ride to your dentist visit? You can call between 8 a.m. and 5 p.m. Monday through Friday, except on holidays, to schedule a ride to your child's dentist and back home. Each region of the state has a different transportation broker. To schedule a ride at no cost, you must call at least 48 hours before your appointment. Weekends and holidays do not count. For example, for Monday, call by Thursday. For Tuesday, call by Friday. For Wednesday, call by Monday. For Thursday, call by Tuesday. For Friday, call by Wednesday. If you are in Region 1, LeFleur, call 1-855-548-4517. In Region 3, Area Agency on Aging of Western Arkansas, 1-855-305-4157. Region 4, Southeasterns, 1-866-539-0714. Region 5, Area Agency on Aging of Western Arkansas, 1-888-783-6632. Region 6, Area Agency on Aging of Western Arkansas, 1-800-568-9987. Region 7, Mid-Delta, 1-800-569-3359. Region 8, Central Arkansas Development Council, 1-800-385-9992. Region 9, Area Agency on Aging of Southeast Arkansas, 1-866-501-7328. Region 10, Southwest Arkansas Development Council, Inc., 1-888-772-5773. Region 11, Central Arkansas Development Council, 1-800-385-9992. Region 12, Southeasterns, 1-855-223-1225. Always call your transportation broker first. If there is a problem, then call the Medicaid Non-Emergency Transportation Helpline at 1-888-987-1200. This is just a summary of net benefits and services. Read your Arkansas Medicaid Beneficiary Handbook from the Department of Human Services for more information about transportation benefits and services. If your child is covered under AR Kids First B, you will not have net benefits. Billing information. How much do I pay when my child sees a dentist? You pay nothing for your child's covered dental services as long as you see a Delta Dental Smiles for Kids Network dentist. There may be times when you agree to services for your child that are not covered by Delta Dental Smiles for Kids. You will have to pay for those services. Make sure you ask your dentist what services you may have to pay for. If your child has AR Kids First B, a copayment is sometimes required. For questions regarding your copay that your dentist cannot answer, please call us at 1-866-864-2499 for help. Delta Dental may pay the dentist less than the amount charged for a covered service. In that case, your dentist cannot ask you to pay the rest of the bill. If you do not use a dentist or clinic for your child that is part of the Delta Dental Smiles for Kids network, you may have to pay the bill. If your child no longer has Delta Dental Smiles for Kids when the services were provided, you will be responsible for paying those services. How to file a claim. A dentist who is part of the Delta Dental Smiles for Kids network should file your claim for you. However, if you need to file a claim, call us toll-free at 1-800-864-2499. What if I get a bill? Your Delta Dental Smiles for Kids dentist should only bill you for non-covered services that you agreed to pay for while in the office. If you receive a bill and don't know why, call us for help, toll-free at 1-866-864-2499. Is there a maximum amount Delta Dental will pay each year? No, there is no annual maximum under Delta Dental Smiles for Kids. If you have other dental insurance, that insurance will pay before we pay. We will not pay co-payments for other insurance. Your dentist must bill your other insurance before billing us. Tell your dentist that you have other insurance. We may not pay anything after your other insurance pays. Other times, we may not pay for services. If your child is hurt in an accident, we may not pay until other insurance pays or denies payment. If you get money from a lawsuit because of the accident, use that money to pay for your dental bills. If there are still bills to be paid after the money you get is gone, contact us to see if we will pay these bills. If your child is hurt on the job, we will not pay until workers' compensation has paid or denied payment. Dental emergency. What is an emergency dental condition? Examples of emergency dental conditions are severe pain, infection, an injury where your health could be in danger, severe bleeding, uncommon swelling. What to do in a dental emergency? In case of an emergency, do one of the following. Call 911 if you think your child's life is in danger. You do not need approval from us for your child to receive emergency dental services. You have the right to use any dentist in an emergency. During normal business hours, call your child's primary care dentist first. If they are unable to help, call Delta Dental at 1-866-864-2499. We will help find a dentist near you and get an appointment set up. You should get an appointment within 24 hours. After regular office hours, call your dentist's after-hours line if available. If the dentist office does not have an after-hours line, call Delta Dental at 1-866-864-2499 to speak to a healthcare professional. Go to the emergency room closest to you. What if I'm out of Arkansas and have a dental emergency? If your child's life is in danger, call 911. If you need emergency dental services while traveling, call us toll-free at 1-866-864-2499 between 7 a.m. and 7 p.m. We will help you find a dentist in the area you are visiting. After 7 p.m., a healthcare professional will be available to speak with you regarding your child's dental emergency. Call us toll-free at 1-866-864-2499. Covered services. For a product or service to be paid by us, it must be a medically necessary dental service, done by a Delta Dental Smiles for Kids Network dentist, and covered under the Arkansas Medicaid dental program, including any limits. We understand that dental language can be complicated. Feel free to talk to your dentist about any benefits you do not understand, or call us toll-free at 1-866-864-2499 for help. Covered early periodontic screening, diagnosis, and treatment, EPSDT. The EPSDT program helps your child get important healthcare services. Your child may receive all medically needed dental services covered under the Delta Dental Smiles for Kids as long as clinical criteria for the service are met. All medically needed EPSDT services such as medical care, vision, hearing, and more that are not covered by Delta Dental Smiles for Kids may be covered by the Medicaid program. Call DHS to find out what other services you are eligible for at 1-800-482-8988. Covered services for children. Regular dental care helps to keep children's teeth healthy. Covered dental services are available at no cost as long as your child sees a Delta Dental Smiles for Kids network dentist. If your child is covered by AR Kids First B, you may have to pay a copayment. Covered dental services are dental exams, including regular exam, periodic exam, no more than 2 per year, and limited exam, problem-focused, no more than 2 per year. Preventative services include risk assessment, no more than 1 per year, teeth cleaning, no more than 2 per year, topical fluoride and/or fluoride varnish, no more than 2 per year, dental sealants, first and second permanent molars, 1 per tooth, silver diamine fluoride, no more than 2 per year per tooth, limited to 4 per lifetime of the tooth, gum maintenance, no more than 1 per year, X-rays, including bite wings, no more than 2 bite wings 2 times a year, full mouth and/or panoramic X-ray, no more than 1 every 5 years, and X-rays taken inside and outside of the mouth. Restorations, including silver filling, no more than 1 per tooth per surface every 2 years. Composite resin, tooth-colored filling on front teeth, no more than 1 per tooth per surface every 2 years. Stainless steel crown, primary, no more than 1 every 5 years. Stainless steel crown, permanent, no more than 1 every 5 years. Surgery, including extractions, tooth reimplantation and/or stabilization or displaced tooth, no more than 1 per tooth. Biopsies, surgical treatment of diseases, injuries, deformities, and defects. Incision and drainage of abscesses. Other services include root canals, dentures, partials, braces, space maintainers, additional gum maintenance, removable and fixed appliance, thumb sucking, and tongue thrusts. More dental covered services are emergency services, including emergency dental services that are used to stop severe pain or get rid of infections, including problem-focused exams, tooth removal and/or oral surgery, tooth reimplantation and/or stabilization, biopsy, surgical incision and drainage, anesthesia, treatment to relieve symptoms, tooth root and/or panoramic X-ray, treat tooth nerve and pulp, office visit after regularly scheduled hours. Stabilization services. The following services help your child keep basic functions, such as talking or eating. Talk to your dentist to make sure these services are covered prior to any work being done. Fillings for large cavities, re-cement crown, scaling and root planing, crowns, including stainless steel for back tooth, resin for front tooth, extractions and/or tuberosity reduction, complete dentures, no more than 1 per lifetime, repairs to dentures or partials, replacement bridge. Lifetime benefits. Some benefits are only covered one time in your child's life, for example, dentures. If Medicaid has already paid for you to have one of these services, you may not be able to have the service under our plan. Call us with questions about these services. Prior authorizations, approval. Certain services or benefits require Delta Dental's pre-approval. Your dentist is responsible for getting approval from us. If the services are not approved by Delta Dental, you and your dentist will receive written notices. You do not have to pay for services you did not need and did not choose to receive. If you choose to have a service you do not need, you will have to pay for it. You may appeal Delta Dental's decision to not pay for a service by following the grievance and appeals process, beginning on page 23 of this handbook. Services not covered. The list below shows some of the services that are never covered by Delta Dental Smiles for Kids, unless medically necessary. You can agree with your child's dentist in writing to have these services done. If these services are done, you have to pay the dentist. Please note, this is not a complete list. Other services may not be covered. If you have questions about whether a service is covered, call us at 1-866-864-2499. Services that are not covered: cosmetic procedures, gold foils and inlays, implants, provisional services, splinting, teeth whitening, experimental services. Beneficiary rights and responsibilities. Getting dental services is a private matter. We respect you and your child's right to privacy. You and your child have the rights and duties listed below. Beneficiary rights. As part of being with Delta Dental Smiles for Kids, you and your child have these rights. 1. Your child has the right to be treated with respect, dignity, and privacy. 2. Your child has the right to receive care. Race, color, nationality, disability, sex, religion, or age do not matter. 3. You have the right to get correct, easy-to-understand information to help you make good choices. 4. You have a right to file a complaint or grievance about us, a dentist, or the care you receive. 5. You have the right to file an appeal about an action or decision we made. 6. You have a right to know: A. How Delta Dental decides whether a service is covered and/or medically necessary. B. Who in Delta Dental's office decides these things. 7. You have the right to know the names of the dentists in the Delta Dental Smiles for Kids network. 8. You have the right to pick from a list of enough dentists that you can get the right kind of care when needed. 9. You have the right to take part in all decisions about your child's dental care. This may include refusing treatment. 10. You have the right to get a second opinion from another dentist about what kind of treatment is needed. 11. You have the right to be treated fairly by us, Delta Dental Smiles for Kids network dentists, and other dentists. 12. You have the right to A. Talk to a dentist in private. B. Have dental records kept private. C. Request a copy of dental records. D. Ask for changes to those records. 13. You have a right to know dentists who can advise you about your child's A. Health status, B. Dental care, C. Treatment. 14. You have a right to know you are not responsible for paying covered services. Delta Dental Smiles for Kids network dentists cannot require you to pay for your child's covered services. 15. You have the right to receive all information, including, but not limited to, informational materials, instructional materials, available treatment options, and alternatives in a manner and format that may be easily understood. Please contact us toll-free at 1-866-864-2499. 16. You have a right to get a spoken translation at no cost for all non-English languages, not just those identified as prevalent. 17. You have the right to recommend changes in policies and services under Delta Dental Smiles for Kids. Write us or call toll-free at 1-866-864-2499. 18. You have the right to receive detailed information on emergency and after-hours coverage to include, but not limited to, A. What constitutes an emergency medical condition, emergency services, and post-stabilization services. B. Emergency services do not require prior approval. C. The process and procedures for obtaining emergency services. D. The locations of any emergency settings and other locations at which providers and hospitals provide emergency services and post-stabilization services covered under the contract. E. Your right to use any hospital or other setting for emergency care and post-stabilization services. 19. You have the right to be able to request and receive a copy of your child's medical records and to request that they be amended or corrected. You get one free of charge. 20. You have a right to have your privacy protected in accordance with the privacy requirements in federal law to the extent that they are applicable. 21. You have the right to exercise these rights without adversely affecting the way Delta Dental, providers, or DHS treats you. 22. Your child has the right to be free from any form of restraint or seclusion used as a means of coercion, discipline, convenience, or retaliation as specified in the federal regulations on the use of restraints and seclusion. 23. You have the right to make recommendations about these rights and responsibilities. Beneficiary responsibilities. There are things you need to do as a Delta Dental Smiles for Kids parent or caretaker. Doing these things helps your child get the most out of their dental benefits. It also helps us work with you better. These responsibilities are: 1. You should try to follow healthy habits for you and your child. 2. You should work together with your dentist to pick a treatment that you have agreed on for your child. 3. If you have a disagreement with Delta Dental, you should first try to resolve it using Delta Dental's grievance process, beginning on page 23 of this handbook. 4. You should learn what Delta Dental Smiles for Kids does and does not cover. 5. You should read this handbook to understand how the rules work. 6. If you make an appointment for your child, you should try to get to the dentist's office on time. If you cannot keep the appointment, be sure to call and cancel it. 7. You should be active in decisions about your child's health care. 8. You should present your child's Delta Dental Smiles for Kids ID card when receiving dental care. 9. You should report any fraud or wrongdoing to Delta Dental or the proper authorities. This may be about Delta Dental or other dental or medical plans. See page 28 of this handbook on how to report waste, abuse, or fraud. 10. You should understand your child's health problems and participate in developing mutually agreed upon treatment goals. 11. You should inform Delta Dental of any change of address or any changes to enrollment that could affect your child's eligibility. Use your benefits wisely. 1. Do not get services for your child they do not need. 2. Follow your dentist's advice for your child. This will help with your child's dental and overall health. 3. Do not try to get prescription drugs you and your child do not need. This is tracked, and Medicaid can restrict you to one drugstore. Grievance and appeal. How to file a grievance or ask for an appeal. You can tell us if you are not happy with any part of Delta Dental Smiles for Kids, Delta Dental of Arkansas, a dentist, the services your child received. You will get an answer if you file an appeal or grievance. What is a grievance? A grievance is a complaint about Delta Dental Smiles for Kids, Delta Dental of Arkansas, a dentist, services you received. How do I file a grievance? You can file a grievance by doing one of the following. Call toll-free at 1-866-864-2499. Send a fax to 833-866-4650. Write us at Delta Dental Smiles, Attention Appeals and Grievances, P.O. Box 6247, Sherwood, Arkansas 72124. We can help you complete any forms and answer your questions about filing a grievance. Processes and timeframes. We will let you know we received your grievance. We will return a summary of the process and timetable for resolving the grievance. We will respond to a grievance within these times. Standard non-clinical grievance within 30 calendar days of receiving your grievance. Non-emergency grievance that involves active clinical issues within 5 business days of receiving your grievance. Grievance related to ongoing issues involving emergency care within 24 hours of receiving your grievance or by the close of the next business day. We may extend the time frame by up to 14 days if you or someone speaking for you requests the extension. We think there is a need for more information or a delay may be in your best interest. If we extend the time frame, we will give you notice of the delay, provide notice that you may file a grievance about the decision to delay, resolve the grievance as fast as possible and no later than the date the extension expires. Delta Dental will respond to a grievance in writing within the time frames described above. A state fair hearing is not available for a grievance. What is an appeal? An appeal is a request for a review of an action by Delta Dental. An appeal can be for any of the following: denial of services or where we only approved part of a service, limiting or stopping services that had been approved, denial of all and or part of a payment for a service, not providing services fast enough, not acting within time limits for appeals and grievances. Processes and timeframes. Filing. You can appeal by calling or writing to us within 60 calendar days after you receive the denial, reduction, or failure to pay notice. You must follow up a call with a written appeal. File an appeal by calling toll-free at 1-866-864-2499, sending a fax to 833-866-4650, writing us at Delta Dental Smiles, Attention Appeals and Grievances, P.O. Box 6247, Sherwood, Arkansas 72124. We can help you complete any forms and answer your questions about filing an appeal. We will let you know we got your appeal and give you a summary of the process and timetable for resolving the appeal. This will include information on the following: when you can present evidence or testimony and to make legal and factual arguments, your right to request records from the file relating to your appeal. This may include dental records and other evidence used by Delta Dental or its representatives. The timetable we will follow until we send the final decision. Timing. We will resolve an appeal within these times. Standard non-clinical appeals within 30 calendar days of receiving your appeal. non-emergency appeals that involve active clinical issues within 5 business days of receiving your appeal, appeals related to ongoing issues involving emergency care within 24 hours of receiving your appeal or by the close of the next business day, extensions. We may extend these time frames by up to 14 calendar days if you or someone speaking for you request an extension, or we think there is a need for more information or a delay may be in your best interest. If we extend the time frame, we will give you notice of the delay, provide notice that you may file a grievance about the decision to delay, resolve the appeal as fast as required by your health condition, and no later than the date the extension expires. If Delta Dental does not follow the times above, you can move to the state fair hearing process. Opportunity to request hearing on appeal. If you want to provide written or spoken testimony, we will give you an opportunity before a decision on the appeal is made. You may be represented by an attorney or other representative. Resolution of appeal. A decision on an appeal will be in writing. We will use our best efforts to call you to inform you of the results of an expedited appeal. State fair hearing. If you are not happy with our decision on your appeal, the second step in the appeal process is to ask for a state fair hearing. You must ask for this within 120 calendar days of receiving the appeal decision. To request a hearing, write to Arkansas Department of Human Services. Attention, Arkansas Medicaid Appeals Liaison, 700 Main Street, Little Rock, Arkansas, 72201. You can speak for your child or have someone else speak for them. This could be a friend, a relative, a spokesperson, a lawyer. Your dentist may ask for a state fair hearing for your child. You need to give your dentist approval in writing first. You will need to sign a form. We will give you a form to sign if you ask us. This form will say that you know your child's health information may be shared publicly during the state fair hearing process. Continuing your child's benefits. You can ask for your child's benefits to continue during the appeal and fair hearing processes. All of the following must apply. Your appeal has to do with a change in our approval of care already in place. Your initial appeal was filed within the time limit stated above. The services were ordered by an approved dentist. The approved time of service has not expired. You made a request on or before the later of the following dates: 10 calendar days from the date of our notice to you limiting your child's benefits, or the intended effective date of the action stated in the notice. We will pay for the services you ask to be continued if the state fair hearing decision is in your favor. If it is not in your favor, you may have to pay for all or part of the services used. Fraud, waste, abuse, and overpayments. We are dedicated to doing business in an ethical and legal manner. We want you to prevent and report fraud, waste, and abuse. If you suspect fraud, you need to report it. Let us know if you know someone that is doing something wrong. You can report it to Delta Dental of Arkansas at 1-866-864-2499 or directly to the state or federal agencies on page 29. Definitions. Abuse refers to overused or unneeded services. Abuse also includes member actions that result in unneeded costs to Delta Dental Smiles for Kids. Fraud is a false action used to get something of value. Waste is the misuse of services. Overpayments refer to any amount that is not approved to be paid by Delta Dental Smiles for Kids. This may be a result of wrong or improper cost reporting, improper claims, unacceptable practices, fraud, abuse, waste, a mistake. Examples of fraud, waste, abuse, and overpayments: giving your child's ID card to someone else to use, billing for healthcare services that are not needed, billing twice for the same service, using the wrong billing code to get extra payments, making false documents by changing the date of service for a claim, medical records, paying or taking a bribe, billing for services done by others, giving false or misleading information about services, misrepresenting the services that are done, such as changing a code to get extra payments, keeping overpayments or not reporting overpayments. Dentists can be sanctioned for unpaid overpayments. giving or ordering services and tests that are not needed, submitting claims for services ordered by a dentist excluded from federal and/or state-funded healthcare programs, lying about degrees and licenses. Report of fraud, waste, abuse, and overpayments. Report to Delta Dental. You can report directly to Delta Dental of Arkansas. Call us toll-free at 1-866-864-2499. Report to state agencies. You can report to the agencies listed below. Call the Arkansas Department of Human Services at 1-800-482-8988. Report to the federal government. Contact the U.S. Department of Health and Human Services, Office of the Inspector General. Contact this office by phone, fax, email, or mail. U.S. Department of Health and Human Services, Office of Inspector General. Attention OIG Hotline Operations. P.O. Box 23489, Washington, D.C. 20026. Phone 1-800-HHS-TIPS. That's 1-800-447-8477. Fax 1-800-223-8164. TTY 1-800-377-4950. Email hhstips@oif.hhs.gov. Your child's privacy. Your child's privacy is important to us. We respect and protect your child's privacy. Delta Dental uses and shares information to provide your child with dental benefits. We want to let you know how your child's information is used or shared. Your child's protected health information, PHI. PHI means protected health information. PHI includes your name, beneficiary ID number, or other identifiers, and is used or shared by Delta Dental. Why does Delta Dental use or share your child's PHI? To provide for your child's dental treatment, to pay for your child's dental care, to review the quality of the care your child gets, to tell you about your child's choices for care, to operate Delta Dental Smiles for Kids, to use your child's PHI for other purposes as required or permitted by law. When does Delta Dental need your written authorization, approval to use or share your child's PHI? We need your written approval to use or share your child's PHI for purposes not listed above. What privacy rights do you have? To look at your child's PHI, to get a copy of your child's PHI, to amend your child's PHI, to ask us not to use or share your child's PHI in certain ways, to get a list of certain people or places to whom we have given your child's PHI. How does Delta Dental protect your child's PHI? We use many ways to protect PHI across our company. This includes PHI in written word, spoken word, or in a computer. Below are some ways. Policies and rules to protect PHI. Limit who may see PHI. Only our staff with a need to know PHI may use it. Our staff is trained on how to protect and secure PHI. Staff must agree in writing to follow the rules and policies that protect and secure PHI. We secure PHI in our computers. PHI in our computers is kept private by using firewalls and passwords. What must Delta Dental do by law? Keep your child's PHI private. Give you written information on our duties and privacy practices about your child's PHI. Follow the terms of our Notice of Privacy Practices. What can you do if you feel your child's privacy rights have not been protected? Call or write us to report your suspicions. Call or write to DHS to report your suspicions. We will not hold anything against you. Your action would not change how we treat you in any way. The above is only a summary. Our Notice of Privacy Practices has more information about how we use and share PHI. Our Notice of Privacy Practices is on our website at www.deltadentalsmilesforkids.com. You may also get a copy of our Notice of Privacy Practices by calling us at 1-866-864-2499. Here's a little helpful information from Delta Dental Smiles for Kids. Delta Dental of Arkansas. Customer service 1-866-864-2499. Website DeltaDentalSmilesForKids.com. Mailing address, P.O. Box 6247, Sherwood, Arkansas 72124. Arkansas Department of Human Services. Customer Service Line, 1-800-482-8988. Complaint Hotline, 1-888-987-1200. Complaint Hotline TDD, 1-800-285-1131. Fraud Hotline, 1-855-527-6644. Website, humanservices.arkansas.gov. Arkansas Relay Service, 711. If there is a problem with non-emergency transportation, call the Medicaid Non-Emergency Transportation Helpline at 1-888-987-1200 for free.